Task 16. We're going to be doing a TPR on a feline patient. So the first thing when you go in the room is just observe their appearance. Kind of let them walk around and get to know you, and you can kind of get a sense of their temperament. He seems to be very friendly. He's rubbing up on me and seems very interested in the room, so I know he's probably not going to be an aggressive cat. He seems pretty comfortable. We can also look at his hair coat. He looks like he is an outdoor cat, so his coat looks pretty good. Just by looking at it, I will feel later to see if he's got any scabs or anything like that. But I don't see any hair loss or alopecia or any waxy debris or flakiness in his fur. Another thing we can look at is his gait and posture. So he's walking normally, which I'm looking at him over there, he's walking just fine. I don't see any issues with his posture. He seems to be walking just fine. So the other thing we can look at is the body condition. I can kind of see his hips a little bit, so maybe I'd call him a 4 without touching him. And then the next thing we're going to do, also our tray of supplies over here, we've got our scale ready and our temperature, thermometer to get the temperature, and our lube. So we're going to go ahead and get his weight really quick. I'm going to turn on the scale and get it ready. I know, buddy. So he's very friendly. You're a good boy. Okay. So we're just going to pick him up, put him on the scale. Stay on the scale, bud. So he is 10.6 pounds. So I'm going to hand him over to the assistant to restrain. And we want to just use the most minimal restraint as possible to kind of keep him nice and calm. So we are going to go ahead and in his chart, write his weight down. All right. So the next thing we're going to do is look at his perfusion indicators. So if you want to put his head to me, Daniel. I'm going to look at his mucous membranes, and we're going to see, we want them to be nice and pink, which they are. He looks like he's got a little gingivitis right there. It's a little pinker. But his gums look nice and pink, and they're moist, so that's what we want to feel. The gums are nice and moist, so we're not really concerned about him being, tells us a little bit about the hydration status, so he's probably not dehydrated. They're nice and pink, so he's well oxygenated. You want to look for any kind of icterus, any pale mucous membranes, anything abnormal like that. Now, the next thing I'm going to do is check his capillary refill time. So I do that just by pressing on the mucous membrane and watching the blood flow back. And his is about 1 second. Yeah, which is normal. You want it to be less than 2 seconds. So after we do the perfusion indicators, we're going to go ahead and check his heart. So with the heart rate, we want to look at all of the point of maximum intensities, which are his valves. So on the right side, it's going to be his tricuspid. So we're going to go ahead and listen to that. And then on the left, it's going to be his pulmonary, aortic, and mitral valve. So we want to make sure that we check all those. I'm going to check his other side here. Okay, everything sounds really good, and now I'm going to go ahead and calculate his heart rate. So we did that for 15 seconds, and his was 45, which is 180, which is normal for a cat. So now we're going to go ahead and check his femoral pulse and make sure that they're in sync with the heartbeat. With every heartbeat, we should feel a pulse. So we're going to do that, and I'm just going to come around. All right, and that sounds good. For everyone, I did feel a pulse, and it was nice and strong, so that's good. The next thing we're going to do is listen to, or just watch his respiration, make sure he's not breathing really heavy. We want to make sure we're not seeing any discharge out of his nose or his eyes or anything like that. He seems to be breathing with normal effort. We also want to check the lungs and auscultate them. So for the right lung, there's 4 lobes, the cranial, caudal, accessory, and middle. And then for the left, there is just cranial and caudal, but we want to check all of those fields when we're ausculting the lungs. I'm flipping them over. All right, so he sounds great. The next thing I'm going to do is come around and look at the clock here, and we're going to get his respiration rate. And I'm just going to watch it. All right, so that was about 15. Which would be 60 altogether, which is normal for them being in the clinic. And then after the respiration rate, we're going to go ahead and get the temperature. So in my tray of supplies, I'm just going to grab the lube. And all for this manufacturer, we just have to put it in his rectum and then turn it on if you just want to restrain him a little bit more, because he might not appreciate this. So good boy, I know. Okay, and it was 100.2, which is normal. So now we just need to record everything in the record. So earlier we were talking about calculating we got the heart rate and the respiration rate. The only thing I did there was timed it for 15 seconds and then multiplied that by 4 to get the beats per minute or the breaths per minute. So we just want to record all of that in our record for the doctor.